Now, there was a companion diagnostic, right? It was a complement to the approval, right, of Olaparib. But truthfully, we can use any of the germline. Is that
I think we
right?
do.
Yeah.
I think we're using by any CLIA-approved lab. I think BRCA germline mutation would qualify for use of Olaparib.
So we have to have the germline BRCA, but any CLIA approved, that's fine.
I think so.
Just an aside question is, if we're going to get the germline BRCA testing, should we do panel testing for our metastatic patients? Is it more costly to do that, or we would anticipate it probably be covered okay, since we're kind of getting that pretty much, I think, across the board in the early stage setting? What do you think? What do you do?
Well, I think that for the early stage or for germline testing, for most patients, it's not very common to just be getting BRCA1 or 2 anymore. Honestly, there are other high-risk breast cancer susceptibility genes. There are moderate-risk ones like ATM and CHEK2, and there aren't any predictors or indications specifically for testing for those more moderate-risk ones. So I think a lot of breast cancer patients are getting the panels for breast cancer susceptibility genes, perhaps for ovarian cancer susceptibility genes, because there are some new genes that for which mutation carriers should probably be having a discussion about prophylactic oophorectomy. So I think a lot of these genes that are breast and ovarian cancer susceptibility genes are DNA repair genes, just like BRCA1 and 2. They function in the same pathway. Whether the patients with germline or somatic mutations in those other genes will respond to any of these therapies or anything we're talking about is relevant to them, we don't know yet. But in terms of risk prediction and risk management, I think a lot of patients are getting multi-gene panels with cancer susceptibility genes to other cancers.
And that might help them with regard to enrollment in clinical trials.
Absolutely.
If they're in the metastatic setting, get the panel, they come up with an ATM, there's a trial for them, right? So that's pretty good.
Absolutely.
Yep.